The coronavirus pandemic has ground operations to a halt across the world, a health emergency that was declared so by the World Health Organization on the 31st of January after more than a month of uncontrolled infections originating from China. W.H.O has on several occasions accused countries of slow response to the virus, a situation that could have led to the current spread. But the U.S. president has all the while been of a different opinion, accused by American observers of taking too long to act. And now Trump believes W.H.O is to blame, and to teach them a lesson, funding is being suspended.
Today I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus.
At the moment, WHO is supporting much of the coronavirus response by governments in developing countries, including Kenya.
Obviously, we begin to get concerned, and we hope. We have not had any reduction in our association with the WHO. As you have just heard me say, they are the ones who are continuing to assist us.
But that stoppage of funding will only affect the programs going forward, not the current programs that are in place. In fact, as we see today, we have received a consignment of PPEs through Ethiopian Airlines that have just landed in Nairobi from WHO.
WHO's budget for the period 2020 to 2021 is 514 billion shillings. Out of this, 15% is financed by the US through mandatory contributions and voluntary contributions. Every member state of the WHO is expected to pay an amount proportionate to its wealth. With the US being the wealthiest nation, it contributes the highest amount as mandatory contribution. Mandatory contributions account for 18% of WHO revenue, with the balance raised through voluntary contributions by countries and donors. For the year 2020, the US was expected to make a mandatory payment of 12 billion shillings payable by the 1st of January. As at end of March 2020, the amount was pending according to WHO records. In total, the US owed WHO over 21 billion shillings as of January this year.
I think it is a disastrous decision, and it's not a decision that should be made right now in the midst of a global health crisis. We're dealing with COVID-19, a virus which is killing people.
In the year 2017, the US made a voluntary contribution of 42 billion shillings, a figure that has been rising consistently. The fate of such contribution now is in jeopardy. The US system, however, requires the legislature to set aside funds for organizations such as WHO.
Even though Congress has the power of the purse, our Constitution gives the president so much leeway and so much room to make unilateral decisions, to the point where, yes, the Constitution says one thing, that Congress has the power of the purse, where in fact the president can sometimes do something otherwise. But what I can tell you is that the Democrats are not happy with this decision.
The US has reported the highest number of infections globally, currently at over 616,000 infections with more than 26,000 deaths. Trump has been on the receiving end, accused of mishandling the situation. A section of US donors have accused him of deflecting the pressure. Should Trump's directive hold for long, WHO programs that prioritize polio eradication, access to healthcare, and prevention and control against outbreaks could be at risk.
America will not be safe until corona is extinguished in the rest of the world. If you have corona in Kenya, DRC, no country is safe.
The WHO has not in itself, pronounced itself on this issue, and therefore we hope and trust that these are issues that are being discussed at that level, and hopefully some form of agreement will be met.
Sam Kituku, Citizen TV.